gonna share my screen. And I just want to make sure that this works. I just want to make sure it works. Okay, can everyone see my screen, or maybe like a thumbs up, or Deb, if you can say you can, yes, okay, great. All right, as Deb had mentioned, I am Jennifer Graney. I'm from Consularium Group. I am so very fortunate to be working with Alfred University on your employee benefits. I welcome you today. I want to just apologize. You know how in your mind you stick to a time that you think a meeting starts, when in reality it's not that time. I thought it was at 12:30. I was convinced it was 12:30. So I apologize for my tardiness. But I am looking forward to this conversation today. We will be reviewing your dental and FSA plans. The kind of the goal specifically around the dental is because on January 1st, the university changed carriers on the dental plan. Our intent is to really make sure that with the shift over to Guardian, that you understand kind of what is available within the dental plan offerings, and as Deb said, answer any questions you have. But because it's new, we want to make sure you're taking advantage of all of the built-in benefits within the Guardian plan, and just kind of walk through where you find information. And then we'll go into a little bit about the flexible spending. That's with BRI, but that's been obviously around for a while. Just want to make sure everyone is up to speed on those resources as well. Okay, so dental insurance. I'm going to minimize. You don't. One sec. Okay. So again, the move over to Guardian, visiting your dentist isn't just about your teeth. Getting regular checkups can provide early detection of conditions like diabetes, heart disease, and stroke. So, dental care is really important. Obviously you have, if you're enrolled in Alfred's Univera health plan, you have your health plan, but making sure you get your proper dental care throughout the year is vital in terms of your overall health. In addition to keeping healthy, dental insurance helps you obviously save some money. Dental expenses can be pretty hefty, so making sure that you're utilizing your dental plan to the best that you can through preventative care like cleanings and x-rays, but you also have some of those other benefits that you can access for basic and major services, and in times of orthodontia. So really this slide is just to say, make sure that you're taking advantage of your dental plan. We do look at utilization in general, and it can be a bit surprising that people aren't necessarily getting their preventative health dental services. So again, we're encouraging everyone to go ahead and do that. You have the plan in place, so definitely access the care. So when you enroll in the dental plan, so probably for the most part, everyone on the screen is in the Guardian plan. You have access to probably one of the largest national networks, dental networks out there with Guardian. Although, and I'll get into it in the next slide, there are in and out of network benefits, but we always encourage folks to, if you can access a in-network Guardian provider, that's where it's going to be the best, cost saver in terms of your out-of-pocket costs. Once you go outside the network, you're going to be balance billed. It's not going to be as robust in terms of the cost you're seeing versus going in network. On the right-hand side, it says Guardian does make it easy, but I just want to make sure no ID cards are necessarily needed when you go to the provider office. They can, as long as you can tell them that you're with Guardian, they can do an easy lookup, but I'll get it into it in a couple of slides, is you can still access an ID card through the Guardian website. But just know that you don't necessarily need an ID card. So depending on what plan you're in, Alfred University offers two options, the high plan and the low plan. You can see here that it's a really robust dental plan that I've seen with Alfred's offerings. Very nice comprehensive coverage. And, I kind of lay this out, but basically both plans covers services from all the way from preventative, basic, major, and orthodontia. Really the big difference here is the annual maximum. So depending on what plan you've selected for yourself and your family members will determine how much your annual max, so the most that a guardian will pay for dental services. And for example, if you look at kind of the middle section of the slide, it says annual max benefit. The high plan's $2,000, the low plan's $1,000. I get a lot of questions of, is that like if I'm in a family plan or a two-person plan, is that for total? No, it's per person. So just understanding that. I'll get into the max rollover in the next slides. This is actually a unique new benefit, something that your old plan prior, before we shifted over to Guardian, did not have. So this will be new concept for you if you're enrolled in Guardian's plan. As I mentioned, ortho is available coverage, and then and the dependent age to age 26. That's who you could cover for dependents. Okay, so again, this is a new benefit, so I want to make sure that folks understand what this means. So get the maximum from your dental benefits. So this is specific to the low plan, but both the low and high plan have this maximum rollover rewards program. So basically you get rewarded for going to the dentist with Guardian's maximum rollover health program. This program encourages you and rewards you when you visit a dentist. And basically, it allows you to, if you go to say you go get a cleaning in one of the, in the calendar year, you might not use all of your annual maximum. So if your plan annual maximum in the low plan is $1,000, you might not necessarily use that. So maybe you just go for a cleaning or two. You're not eating into really that much of the annual max. So what happens is, as long as you had that preventative service, you can roll over a portion of that annual max. If you go to in-network providers with Guardian, you can roll over an additional $350 into next year. If it's out of network, but you still have some annual max left over, it's $250. So essentially, this helps you because next year, so this is really going to apply when we go into 2026, is that if you have, you've seen a dentist, you didn't exhaust your $1,000, you have a portion that can be rolled over up to $250 or $350, depending on your provider. And so next year, when I come out to, through open enrollment and the start of the new plan year, if you're eligible for this, you're now, in addition to the $1,000, you can have, now your new annual max is $1,250 or $1,350, depending on your circumstance. So this is a great benefit. Maybe not something necessarily you'll see, when you go into Guardian right now, because the rollover applies to next year. But why I bring it to your attention is because we make sure that you go get your preventative your cleanings, because if you don't, you won't see this rollover apply to you next year. So there's kind of an underlying requirement. So nice benefit that, you know, it's helpful because next year, if you actually maybe have an increase to 1250, call it, maybe at that point next year, you're going to need a greater amount than just the $1,000 because maybe you need to have a crown or you have a cavity or something that will possibly eat into a higher annual max. So, and this will build. And I'll talk to you in a slide or two about how you can see what your balances are, you know, claims, all of that with Guardian. Okay. This slide right here is just basically reiterating the rollover, but under the high plan. But same concepts, a little bit higher annual max threshold to roll over. So, but again, the concept still applies. And just note, after this meeting, I will put this in a PDF document, send over to the HR team to be distributed so you have a point of reference of everything that we're talking about. Okay, so moving over, how to find a dental provider. This has always been a good question, especially when you move to a new dental carrier for the plan year is, how do I know who is actually in network with Guardian? And I want to caveat that is that when you go to a provider, it can be a little bit confusing because depending on how your provider receives the question is, if you ask, hey, do you accept Guardian versus are you in network with Guardian are two different things. They may accept your insurance, but they may be out of network. So I just want to make sure folks understand that. And the best way that you can confirm if they're in network is by going onto Guardian's website, and you can find a dentist and their search parameters you can locate. You can actually drill it down to the actual provider name, or at least in the radius of where you live, who is participating. And you can see that information. So really good tool to use. And then what I would say too is that if your dentist is not participating, again, Alfred's plans have out-of-network benefits. It's just going to be possibly additional out-of-pocket costs to you, but it's not that you don't have insurance. So, okay, so this one, Guardian Anytime, same kind of website. Make sure that you register and log in. So with this move over to Guardian, you might not have had an opportunity to register. So this is a good time while we're talking about it, is to go onto Guardian's website. You can register, create a login, and then it will pull up your information. So if you've already had a claim cost, or you can see that status or what's been paid out. You can view benefit summaries, forms, all of that. That's also where you can find a temporary ID card if you are looking for a card. So has a lot of great information out there. Okay. So that was kind of the cliff notes, I would say, in this 30-minute workshop of the dental program. If you have any questions with regards to the plans itself or what we've covered, please put your questions in the chat, or we can address them afterwards. I want to move over to the flexible spending account. So the FSA, this is administered by BRI, and if you're enrolled in the flexible spending account. So this is really kind of an overview, things that we've already kind of covered when we went through open enrollment, but just want to make sure folks understand the advantages of FSA and then what to do to submit claims with BRI. So there's medical, dental, flexible spending accounts, all governed under the IRS of what can be contributed, the max amounts. These are pre-tax plans. So basically you can set money aside into these accounts pre-tax. So that's the real advantage of putting money aside into the FSA. So I mean, we've covered some of this with regards to during open enrollment, you went in, you made an election, say you decided for the year that you wanted to put $1,000 into your medical FSA. That's set for the year. And then monies based on the payroll schedule will be deducted out of your paycheck pre-tax for the FSA. And then what's really kind of on the medical FSA side of things, know that whatever you elected during open enrollment, so using that example of $1,000, if that was, that's actually made available to you on day one. So you basically, if you went to, the urgent care or have a pharmacy prescription that you need to fill, although you haven't paid for it out of your paycheck because it's taken out each paycheck, the full amount is available to you day one. So that's the nice features of FSA. This is just an example of why you would possibly want to look at, putting money into an FSA. Just to note, though, is that we're covering this today, but if you're not currently enrolled in an FSA with Alfred, the only way that you're able to come on new is if you have a qualifying event. So otherwise, you kind of have to wait until next year. So in a couple of months, I'll be out there talking about open enrollment, and we'll be having the same conversation with opportunities to enroll into an FSA. But this is just basically saying the advantages tax-wise of why you would put money into an FSA because of that pre-tax component. Beneficial card. So this is when you register with into the FSA, you all likely have a FSA card that you can use. It's a MasterCard. It's a way that you can, access your funds at a pharmacy. Just know, though, I just want to cover a few of these steps. So examples of medical FSA are your out-of-pocket medical expenses, over-the-counter drugs, medicines, devices. Also, part of FSA could be dental and vision expenses. There's a very large list. So I would just refer you to BRI's website that will show you the comprehensive list. Just on dependent care, where I want to call this out is if you've put money aside into the dependent care FSA, it has the same tax advantages of the medical FSA. The only difference, though, is that on the medical FSA side of things, you recall that I said that if you elected $1,000, technically that full $1,000 available to you on January 1st. Dependent care FSA does not work that way. It's whatever's in that account at that time from whatever payroll deductions. So it's not front loaded is basically the difference here, but still tax advantage plan. These are just some examples of the FSA expenses of what you could put money aside: daycare, nursery school, before and after school care, summer camps. And then also, folks aren't aware that dependent care can also cover adult and elder care. So that everyone just assumes that it's for the children, but that's not the case. There's also options for adult care and elder care. Okay. This is just kind of walking through, there's cost estimators out there with BRI because folks ask, well, how much should I put aside into an more on the medical FSA? And, there's calculators that BRI provides, worksheets. So, again, available to you. Okay. Let's skip that one. Again, because we're in the process of, you're already enrolled, you should have already received your beneficial card. that's available to you. Again, you can use your card at qualified merchants, you know, the healthcare merchants, hospital, doctor, dentist, vision, pharmacies, drugstores. I'm going to get into some things that you should be aware of, though. This is where you can, qualified merchants, the FSA store, you can use, so you can always visit the FSA store and then BRI's shop FSA store connected to. That's a great resource. FSA store, I don't know if anyone's ever been there, but they're a great resource of what qualifies for FSA expenses as well. Okay, so this is really important. And as you work through any type of savings account, you always want to make sure that you keep your receipts and documentation. And I'll get into why in the next slide, because BRI has a process. So even though you might have a Beneversal card, BRI has a process where they internally have to verify almost all transactions. And so there might be instances where maybe your card, it approved, but then all of a sudden you receive a letter in the mail from BRI saying, we need substantiation, we need documentation to show what you use your card for is in fact a qualified expense. What I would say is do not disregard that letter, or if you receive information from BRI asking for substantiation, because what happens is if you ignore it after several requests, they can put a freeze on your FSA account. So just be on the lookout. If you ever have questions about something in the mail that you receive from them, reach out to BRI. You could also reach out to HR and myself, and I'll get you in touch with the BRI to make sure. But I just don't want folks' account to be frozen for that. So if you can't use your Beneversal card, just know there's steps that you can take with BRI to submit for claim reimbursement. That's all done through the BRI website. They also have a mobile site too, a mobile app. So it has a lot of information. If you have not registered, just like we talked about Guardian, registering under the Guardian Anytime, we definitely encourage you to make sure that you log in and register under Benefit Resource. That's where you can access all of your, account details, your balance. It'll actually show claim details as well. So great resource under BRI Web and their BRI mobile app. And this is the mobile app right here. Okay. I mean, these are all, you can also do digital wallet. You can add your Beneversal card if you haven't already. I know I attached some of my credit cards to my digital, so you can do the same for the BRI side as well. And this is just their contact information, the hours, the phone number, but but again, the benefit site has the most information there. And I think that's all of what we wanted to cover between navigating your dental and your FSA. And I'm going to stop sharing if I can.
While you do that, Jennifer, there's a couple of questions in the chat. Can you see them?
Yeah, 1 second.
Okay.
Let me just take a look. Okay. Okay. So let me go. What's our plan type that has looked at the site? Is that the dental side, Lori? Is that what we're looking at?
Yes.
Okay. So
there's 3 on the website, when you try to find a dentist, and my thing is spinning, there's PPO dental guard preferred, PPO local elite, and then a managed dental care. So you have to choose
First,
your plan type to be able to find it, just do a search.
it's the first one, the PPO.
I couldn't get it to stop spinning until I
Oh,
switched
no.
to Chrome. So it worked on Chrome, but not in Firefox.
Yeah, I can't look up. Yeah, Chrome, Firefox doesn't work for me to look at my stuff, which is annoying. Yeah. So, but
The
it's
other,
PPO dental guard because there's two PPOs.
you said the first, I said the first one though, right?
Yeah.
The other thing is that you could also, I mean, the web browsers always seem to challenge me as well. And you could also do the Guardian app as well. So I can get that information out to the HR team to distribute out. And I'll also, in my follow-up communications, Deb and team, is I'll kind of put a where to, like a screenshot of, first you do Guardian anytime, and then find a provider, and then I'll indicate which network or plan to select.
That would be great. Thanks, Jennifer.
So the dentist that I've been going to isn't listed as being in network. In order to change, or could you say again what the out of network ones? I'm on the website and I'm trying to find the description for out of network.
So you won't see, so you will not see out of network dentists listed on the Guardian site. It will only list the in-network participating providers. However, when you look at, when I send this deck out, or also we have full benefit summaries available too on the dental plan, is
Yeah,
that
that was what I was looking for.
yep, there's a separate set of out-of-network benefits.
Okay.
And you'll just have, I caution you, anyone who sees out of network, because it may say, for example, both plans 100% preventative, and it'll say 100% both in and out of network. There's this asterisk of, if the out of network benefits are based on what we call usual and customary. So what 9 out of 10 dentists in your area charges for a certain service. And if your dentist charges at like a higher amount than what 9 out of 10 dentists are, and so they have averages for each service within that area, that could change that 100% for preventative cleanings to be a balanced bill. So I always kind of caution people, because it could be, if 9 out of 10 dentists in your area charges $100 for a cleaning, but your dentist charges $200, you're going to have to pay that $100 difference.
Okay.
So that's balance billing. That's the usual and customary. So if you'll probably see that, I don't know if you've had a service yet, but that'll come through.
Got an appointment in a week and a half. So
Okay.
I was trying to check. So, and yeah, trying to decide if I guess I could call the dentist and ask them what they
I would
charge.
inquire. Yeah, I would inquire. I say that
Otherwise I'll
for
have to
any,
find a new dentist, and
yep. It just
don't know
depends
when
on
I'd
what
get
he
in with that.
charges. Yeah, yep. And then, what was the other thing I want to make? Oh, if, regardless if you're in the high or low plan, if you have services, and it could be just maybe a cavity or crown or anything really outside preventative, I would always get a predetermination of what Guardian would reimburse back for that, so there's no surprises. And
So,
your provider could actually submit that ahead of time. So if they know what type of service they're doing, they can submit that ahead of time, and then your out-of-pocket costs.
okay.
I would definitely encourage that I mean, preventative, they're not high dollar amounts, but once you start getting outside of preventative, I've seen surprises and I just don't want that for you folks. So, and your provider knows how to submit a predetermination.
Okay, so you said the information on the coverage for out of network is posted on the website?
No, well, if you register and log in, there's benefit summaries on Guardian site, but we
Yeah.
also have it housed in the benefits enrollment portal, our employee navigator, and also I know HR has it. So maybe as a follow-up, Deb and HR team, I'll have a few notes if we want to attach the summaries again to the attendees, so they have it. I'll
Yeah.
put that all together.
I was just looking, yeah, I was looking for that, the list of the amounts that are considered covered, to compare against the average or.
So they won't
Yeah.
publish that. The
Then how do
carriers,
I know what it's gonna
I know.
be?
That's what I'm saying is that's where we have to have you talk to your provider and determine, letting them know I've moved to Guardian. You're out of network. Can you either submit to tell me what my out-of-pocket costs will be, if anything, or if they can kind of give you a ballpark.
Okay. Do you know how long the turnaround is for that?
So
Like if
Beth,
I've got my appointment
I'm-
next week and I ask them to do a pre-submission.
Beth, I could always go offline with you and you
Okay,
and I
I'm sorry, I
can
didn't
kind of
mean
chat.
to, yeah. I didn't mean to
there's several other
monopolize.
questions in the chat,
Yep,
so,
sorry.
I can connect you two on that, and so there's a
Yep.
couple of other ones in there, Jennifer, if we wanna see if we can catch those, for those that have the time to stay on.
Yeah. Okay. I have a kid who needs orthodontic. Should I go in high or low plan? The high plan has the higher max amount. So it's obviously it's going to be higher in premium, but I always look at what my out of pocket or, exposure is versus how much I pay in premium. But the high plan obviously would have the higher max amount. I answered that one. I already reached the 2,000 annual max. I'm like, okay. Who wrote this? I will take the one offline on the 2,000 annual max and coordination, because that's a little, I need to want to cover that for you. FSA can be used for anyone who is claimed as a tax dependent in your household, whether they're on your health plan or dental plan or not. As long as they're considered a tax dependent. So in terms of benefits in retirement, so medical, dental, and vision and FSA can be our COBRA qualified events. And so if you want to keep your plans, you would have to COBRA those over. All right, I just want to copy your email on this one. Okay, I think I answered all of them. I don't think I missed any.
I don't think you have either. Are there any other questions before we thank Jennifer for her time and let everyone continue on with their day?
I'm just, yeah, I appreciate everyone's time today. I know I went over, apologies on that, very much. But if you have any questions, you can go to the HR team. They have my contact information. You can just email me directly. Happy to help.
Great. Thank you so much for your time, Jennifer, and thank you all
Yes.
for joining us today.
All right, have a great day, everyone.
Thank you. Take care.